Now, I have the privilege of introducing our keynote speaker. Dashu Deshinwangmo is the head of the Prema Secretariat Bhutan, Bhutan's model agency for mental health and social protection under the patronage of Her Majesty the Queen. It is not previously unknown that Dashu served as the Minister of Health in Bhutan, and it is with no exaggeration that I say that her leadership is one of the reasons Bhutan was able to navigate COVID-19 pandemic so efficiently and so effectively. A strong advocate for public health, she also stands as a testimony to the power of women leadership, demonstrating how resilience and compassion can drive meaningful change in governments as well as society. So with great anticipation, now I invite Dashu on the stage.
Lasla, a very good morning, Honorable Dutch Secretary, Ministry of Education and Skills Development, colleagues from and the leadership of the KIX here, international colleagues visiting Bhutan, friends, colleagues, ladies and gentlemen. I was actually thinking about, I had a notes prepared to give the speech, then I thought this is such an incredible platform where I think we, as the PEMA Secretariat, gets an opportunity to share some of the work that we are doing with education. I know, having worked in many countries in the region, I realize what we are doing here is innovative. It's in the face of incubation, and we also see a lot of potential for scalability. Not just nationally, but regionally and globally as well. Then I thought, why don't we talk about the nexus of mental health and education? I promise you, I'm not going to go into the data of how important the correlationship between mental health and education, the value it has, the significance it has, the relation it has, but I rather want to talk about what we are doing. A very humble initiative within Bhutan. Okay, so I'm going to focus on why mental health. Why mental health? Why are we talking about mental health at the moment? Then we want to talk about how we deliver a people-centric mental health system in the country. And then in the end, what we hope to achieve with all these initiatives that we are doing. And I must say, PEMA is fairly a new organization. We would say we are almost 3 years old, so fairly new compared to many agencies. So when we talk about mental health, oral health is right around the corner. I think the Global Oral Health Day is on March 20th, if I'm not mistaken. So as a public health, we always have this saying, the oral and the mental are the step siblings of the rail health system. And that is true if you look at it globally as well. So you look at the definition of health, this is what the WHO defines health as. So physical, mental, and social health. And if you look at today, whether you look at literature, whether you look at data, whether you look at systems, whether you look at policies, the mental and the social health is forgotten. So I call it the forgotten agenda of health. So we often talk about disease, communicable diseases, infectious diseases, non-communicable diseases, all that. But somehow the mental health and the social health is forgotten, globally, regionally, and nationally as well. And Bhutan is no exception. So when we look at Southeast Asia region, if you look at it, the red, so 25% of the disease burden is mental health. And yet, nothing much has happened. So just take a look at our own self. Let's start with our own self. Let's start with Bhutan. We used to have a small psychiatric unit. More. Look at the human workforce. We have barely 5 psychiatrists in the country. We have 1 adolescents and child specialist very recently, a year ago. And look at demographically, how many youth and adolescents we have in the cohort. Just do a simple math. Every birth cohort is around 11,000. Multiply that by 18 to 25 years. You have it. That's more than 2/3 of your population. But then the workforce or the expertise that is required to cater to that population is hardly anything. It's almost negligible. So similarly, the statement that you see on your right side is not a statement by anybody. This is a statement unanimously accepted by the member states of WHO. So you're looking at 181 countries that agrees that the mental health needs are high, but responses are insufficient and inadequate. And when I say this, again, Bhutan is no exception. You know, we also thought that we have gross national happiness policy, happiness will come in, well-being will come in, like the oxygen we breathe today. You know, but it wasn't happening. It wasn't happening. And that is where, if you look at, for example, knowing, 25% of the disease burden is mental health. Yet the investment on mental health is barely less than 2%. And let me give you an example of Bhutan. In Bhutan, when Her Majesty commanded that, please look at how much we are spending on mental health programs, we realized that if you look at the subsequent plans, 12 5-year plan, 10 5-year plan, we had one activity, observation of mental health day with 3 million Nultram budget. And that was all we are doing. And we expected the well-being and the happiness to come with that investment, So again, that's the reality. And if you want to have conversation, we must have very honest, meaningful conversation and acknowledge where we are, but then also be mindful of what we can do as we go forward. Suicide is a major cause of death among young globally. And again, Bhutan, our Southeast Asia region, is no exception. We are in the process of streamlining suicide registry at the moment, and the numbers we are seeing. We are a 700,000 population, and every life counts, every life matters, every child matters. Doesn't matter where they are for a 700,000 population. So that's where I think when we look at these are alarming numbers, alarming data in the region, in the world, in our own country. And it was during that time, Her Majesty was very, very concerned and saying, how can this be happening in a GNH country? I think we need to really re-examine where we are and what we can do, to really achieve well-being, a people-centric well-being system. So this is where, and I want to quote Her Majesty. It was after the assessment that was commanded by Her Majesty, and then when we presented the report, mental health was everybody's business. Mental well-being was everybody's business. Mental health kache, so important. Mental health is so important. But when we actually came to dissecting why it is important and what are we doing about it to create enabling environment for mental well-being, then we realized that we had nothing to say, Anna, this is what we are doing. This is what we want to achieve. This is how we are going to do, So we all realized that it is important. But then what was lacking is, how are we going to do it? What are we doing about it? And who is responsible for really looking at well-being? And when we look at the data, everything was going uphill. 2017 to 2023, anxiety, depression increased by 300 folds, from 4,000 something to 17,000 cases. And similarly for suicide, self-harm, anxiety, depression, psychosis, But then the investment in this area was peanuts. So it was during that time, Her Majesty said, we just can't put these issues under the rug and pretend everything is nice and happy in a JNH country. We said we must tackle this upfront. We must have strategies in place, we must have systems in place, we must have investment in place to really tackle this issue. And it was during that time Her Majesty initiated the PEMA Secretariat as a nodal agency for mental health and social protection. So this is what Her Majesty, in her first official speech, mentioned, that mental health will have the national priority it deserves. And it was that moment where we as a country realized that we just can't put this under the rug, pretend it's not there, that we had to face the reality and we had to really look at a system which is very comprehensive, very holistic, and people-centric in its nature. So this is what PEMA looks at mental health. So when we often talk about mental health, we talk about mental health as being on either of the spectrum. So we say, okay, we have in many countries that I've worked in, you have mental health, they deal with mostly the psychiatric, psychosis, the extreme mental health disorder. And then on the promotive part and the prevention part, there are other entities doing it. So if you take a moment and reflect, in many countries, these approaches are very fragmented. So we have too many players, and it's not coordinated. So Bhutan, of course, us being very small, Bhutan is very small, we realize that we need to have a different approach. And that different approach is really a holistic approach. We're saying, okay, let's task this agency to not only look at the extreme side of the spectrum, but also on the preventive and the promotive. And that is where I think Ministry of Education comes in. I think throughout our journey, a big chunk of us, Bhutan is a resource-challenged country. That we will all agree. Everybody who is here, I think the earlier speaker was saying, thank you, KIX, for supporting this, the grants, because there are limitations. Resource is a big challenge for us. If we were to ask what is one of your challenges, I think the resource challenge will be somewhat in the second. So similar to that, we realize that for a small country resource challenge, we cannot afford not investing upstream on prevention and promotion, because downstream is going to be very, very expensive. For rehabilitation of every child that we have in our center, 253 graduated, we have another 70 at the moment undergoing rehabilitation. We are spending almost $1 lakh per child. So I think downstream, very, very expensive. Upstream, much cheaper. So that's where I think where our money has to be, where our investment has to be. And for us, for PEMA, one of the key partner in the upstream intervention is Ministry of Health. And I mean, in this forum, I really want to acknowledge the leadership of Dutch Secretary himself as being a champion for mental health, and something that's very close to his heart is mental health and social protection, particularly child protection. And we have had an unwavering commitment from the leadership of Ministry of Education and Skills Development. So when we look at the prevention program, we are also looking at advocacy. No, So when we realize, when we look at advocacy, we see a lot of teachers here who, or a few of you who wants to be a teacher. When we tell them, what are you doing in terms of promoting mental health? We're saying, oh, you have to be happy, content, all this. But there's no manual. There's no standardization. Now, if you want behavior change, there has to be a process in behavior change. And that's scientifically proven, right? So I think earlier we had a conversation around evidence-based. And this is where the evidence is suggesting that if you want behavior change, there has to be consistency in information, there has to be consistency in delivery, and consistency in change. And if that has to happen, then we need to have a targeted manual. I give you an example, substance use law, which we all know is a huge concern. And His Majesty had a dedicated National Day address on substance abuse law. When we go to schools, we say, oh, do you talk about substance abuse? Oh, yes, la, we talk, we assist. That's it. No. So now what we are doing in collaboration with Ministry of Education, with Ministry of Health, is that we are coming up with a module where we are saying, okay, children, how do we make children understand the implications of substance on their brain, their own well-being, their family, their friends? No. So then we will train the teachers to actually deliver these messages. So that because these messages that you will be delivering are not only targeted, but also evidence-based, based on science. So that is what we are looking at. We are also looking at integration of mental health in the policies and legislation. PEMA is a service delivery agency. We don't do policy, regulation, rules, but we do facilitate. We are a catalytic agency for facilitating integration of mental health into these provisions. And then we have the new upcoming with support from UNICEF. We're working on these adolescents, helping adolescents thrive. And the idea here is, this is a project partnership with Ministry of Health and Ministry of Education, and UNICEF with PEMA, is we're going beyond surviving. Just not surviving, but we want our children to thrive, as the Secretary mentioned this morning in his education in his keynote speech. So it's going beyond surviving, beyond getting by, but we want our children to thrive. And I think Bhutan, it's a non-negotiable target that we want to achieve. So this is an exciting project that we are launching. We are in the process of contextualizing, as Sangya mentioned earlier. I think it's so important that you have a global tool, but that needs to be contextualized to our own country. The second one in the prevention is PEMA has recently come up with PEMA Wellbeing System, where we have all evidence-based, pre-qualified, WHO pre-qualified tools that are put into the system to screen. So in the coming years, I think we will approach some of the teachers here, principals here. PEMA is planning to roll out a screening tool across the country for 10, 11, and 12 grade students. So then we really understand what is the mental resilience, mental state of our children, to design interventions for them. So that is something that is happening. Unlike many countries, there are too many players. In Bhutan, we have not many players. So even if there are private schools, it is affiliated with Ministry of Education, so it's easier to roll out. So we say that within a year we should have a national level picture of what is happening with mental resilience, mental status of our children in the country. So that is something I think personally we are very, very interested to look at. We are also looking at the integration of mental health in the health system. In 2023, under the leadership of Her Majesty, we managed to get a regional commitment called the Paro Declaration on mental health integration. So we're looking at integrating mental health in the primary healthcare system. So when you go to the, for example, emergency is something exciting. When we go to the emergency department, they are not only talking about your bruises, your cut, and your fractures, but they are also talking about how are you feeling. Simple thing, how are you feeling today? You know, so that then the subsequent services can be provided. This is also a way to capture self-harm, because most of the self-harm lands up in emergency department. But we manage then and there just the cause, but we don't refer them. So we're really looking at, okay, how do we probe these questions? You know, victims of domestic violence, if you have a bruise, you're not only worried about the fracture, but you're also asking the woman, are you safe at home? You know, is there something we can do? So these are clinical integration in the health system. I think we're looking at cancer, for example, a family dealing with cancer. How do we deal with grief? How do we manage grief so that you don't land up in, you know, drinking yourself to death, you know? So these are, so we're working with oncology, medicine, physio, and emergency department at the moment. Primary healthcare integration has already been quite successful. Almost, I think, first country in the region to actually roll this out at the national level. And then actually when we look at the mental disorder, many may not know Her Majesty in 2022 actually, immediately recognizing that there is a need for a mental health hospital. We are constructing a 60-bedded mental health hospital. So on that side, I think a lot of our partnership happens with Ministry of Health in terms of improving diagnosis, improving treatment, improving care pathways and referrals. So these are what we are facilitating with the Ministry of Health. On this side, I think we really look at our Ministry of Education as a key partner, because I think we have a lot of young children from less than 5 to colleges. So this is where I think Ministry of Education, all of you are going to be a key driver, a key champion for these activities, the success of these activities. And as we do this in a holistic approach to mental health, what PEMA is trying to achieve at the wider level. Many may not know the word PEMA. I think when Her Majesty envisioned an organization, I think Her Majesty approached His Majesty and said, what should the name of this organization be? And His Majesty said, why don't you call it a PEMA? And His Majesty there said, you know, not because Her Majesty is Jitsen Pema, but because Pema symbolizing the lotus flower, as we all know, the lotus flower that grows in a very murky water, but given the right enabling environment, that there's an innate belief in the Buddhists that His Majesty always says that the goodness and compassion is part and parcel of our DNA. The belief that every human being is good. The belief that every human being has potential. The belief that every human being, given the right environment, can thrive. And that should be the very mandate of this organization, is to give meaning to life. And this is in our journey, this is what we are achieving. So if you look at, for example, we say proactive and responsive mental health services. I know, I think we have Madam Director here. I was just discussing a case. You know, then before, prior to PEMA, if there was a case of a child abused, example, the report generally takes about a week to reach la. So then the intervention, all that takes time. Sometimes it doesn't even reach us. But today, you all will be very happy to know that moment it happens, within hours, I get the report. So during COVID, we had this arrangement. Wherever there is a COVID positive, we immediately get the report and we deploy support. So today, anything that happens in 20 district, 205 kiosks, anything that happens at any hour, I get the report. And then we activate the system, and the turnaround time is less than 5 hours for delivering services. So from weeks to this, I think this gives us a lot of encouragement. It's not the work of the PEMALA, it's the work of the local government, it's the work of the people who are there, the health worker, the police, mula. It's a collective work. But when we come together, I think we as a Bhutanese can achieve incredible results. And this is like almost unheard of in few years, reducing that turnaround time. And then and there, midnight, 1 o'clock, 2 o'clock, we get the report, we activate 24/7. We activate the response. We make sure that the child is taken care, given all the services. Similarly, I think when we look at the second objective we are trying to achieve is empowering our system. So PEMA doesn't anticipate that we will be there everywhere. So what we want to do is we are the bridge that will help empower the relevant agencies to do their job better. So PEMA is like I said, a catalyst, a facilitator to make that happen. So our focus is really on empowerment of the system. The other one is meaningful collaboration and coordination. And this is where building partnership, not just for the sake of putting our logos on the banners, but going beyond that, getting to put the Bhutanese people in the center of our discussion and trying to create innovations so that at the end our people are served. And the last one is, of course, the advocacy that comes in. We also use the A for adaptability, because being a small country, I think we can be very agile, we can be very adaptive to what the need of the hour is. Anichi matubachin, we can go this way. Afale matubachi, we can go yale, malebe, and jotsubela. So the agility of a system and the adaptability is also very, very important for us, Shunibi. So for us, I don't know, I think when it comes to education, learning, process, systems, I think there are a lot of experts here. So I always say PEMA is a state agency. It's under the leadership of Her Majesty. And Her Majesty, it belongs to all of us. All of us. So if you have some ideas, expertise that you want to collaborate, work with PEMA, please reach out to us. Our office is right below, next to table tennis court. That's where Her Majesty has our office. So the secretariat is housed there. And I think I want to end by saying this belongs to all of us. And this is our collective goal, our aspiration to make GNH a reality. So we always say we are in the business of mainstreaming gross national happiness. And that's what we do. And again, all of you are experts in education. If there's something we are lacking, something that we can do together, please reach out to us, and we'll be more than happy to listen, learn, and take the agenda forward. So last but not the least, I want to thank everybody, KIX for Samtse, education, for giving us this platform to share our journey, our story. So thank you very much. Tashidele.
Thank you very much, Tashu, for highlighting on the PEMA and then the services the PEMA provides with mental health. I think is very crucial in Bhutan and globally, as it directly impacts individual well-being, productivity, and social harmony. And as Dasho highlighted, I think the PEMA rightly symbolizes the basic fundamental goodness that each of us is born with. I think that's a very profound name and the profound services that the facilitative services that the PEMA provides. And also thank you, Dasho, for inviting all of us to reach out and then collaborate with the PEMA. And with, I think, as I represent Samtse College of Education, I think Samtse College of Education would like to collaborate very closely with the PEMA because the college has a counseling program. The college, I think, has a postgraduate diploma in contemplative counseling. So therefore, I think it is an opportunity for the college to work closely together with the PEMA. With this, I would now like to open the floor for discussion if audience have any questions on Dasho's presentation. Is there a mic? Yes. So there is a mic. Please raise your hands if you have any questions. If you wanted to know more about the mental health, the PEMA. Yes.
Hello. Good morning, everyone. I was just wondering about the statistics of the mental health on the mental health data, and that it has been increasing for the past few years. And I was wondering, till 2018, the mental health issues have grown drastically, and that also indicates that people are suffering. But another data states that 2019 has been one of the most crucial years for Bhutan, as it has the most GDP, increasing GDP. So that's why I was wondering if the development of a country can lead to increased mental health issues.
Yes, I think the question is clear. Are there any more questions? We would like to take 2 questions at a time.
Las Kadichela. Mine is not exactly a question, but perhaps a suggestion, perhaps to the Minister of Education. I think this PEMA provides a very good opportunity, platform for us as the Minister of Education to really, take the efforts and the initiatives forward. I believe that we can do that by perhaps integrating some of the, if you look at the right side, spectrum, perhaps the upstream on the perhaps the prevention, on the prevention aspect of it, I think we can integrate them in the curriculum. And we have already done that earlier. Perhaps it's already, it's still there, but I think we might still look at it and see the possibility of further integrating into the curriculum so that it can, the promotion can happen as and when the teaching, goes in the classroom. Thank you so much.
Yes, thank you, Stashu.
Sorry, I thought I will do that and then go there. I forgot about the question and answers. I think data is always very interesting, as the experts here will know, because sometimes it's also the uptake of services that happens. La. So if you look at the Bhutangi graph, which I should have projected, but I forgot, from 2017, around 3,000-4,000 anebe, 2020 onwards is 6,800 to going up to 13,000. So there is definitely a steep from 2020. Now, this could be one reason why this was probably right after the COVID and globally. And so this mirrors basically the global data as well. So if you were to look at the global data, it will mirror exactly Bhutangi data. Even globally, I think after the COVID, people realized that, there was a lot of anxiety, depression. So the mental health really came in the forefront of the global public health discourses and discussions right after the COVID. So even in Bhutan, I think we then became more aware. So there was advocacy, there was services made available, helplines through advocacy, through referral pathway. So then we have a steep uptake. So generally for any program that happens, I think the first phase, the uptake is very high. Second, it's plateaus, and then hopefully it comes down. So it has this bell curve. So I think that is interesting to know. For us specifically, why are these cases? I think it's very difficult. If you look at the estimates, for example, for me, I think every child matters, every life matters. I go by that principle. So when I look at the estimates that came out in the National Health Survey, a bit alarming. Somebody was saying attempting suicide in the last 12 months. 2.1%. But translating that to 15,000, that's quite a lot of lives. So I think this is where I think we also have to take data. I always say with a pinch of salt, Anila. On the development, absolutely. I think today, I'm sure there are studies in other countries where you look at the fear of missing out, the influence of social media on well-being. On social media, everybody is happy, enjoying life. But we have had many cases physically right now about, a child not meeting that expectation, don't know how to cope. Then they go into self-harm activity. We have many cases. PEMA at the moment managing about 1,017 cases with us that we are constantly monitoring. So I think definitely it has an impact. The community vitality, which is one of the GNH indicator, I think us not realizing that is sort of eroding now. So that too has an impact. The way our family structure is, the architecture of our family structure and the community structure, that too has an impact. So there are many determinants of mental health and well-being in Mela. And that's where we realize that the PEMA is the bridge where all these have to make these connections, Anila. So I think excellent question. I think we also now will have a robust data to work with after we roll out the well-being systems in Anichi, Omela. On the suggestion, I think excellent suggestion. I think that is our ultimate goal. If you have any proposition, please let us know. I think we have to mainstream. Otherwise, we always say something that I talk about is hand washing. We have done hand washing for so long, and sanitation for so long. And we're thinking about 10x GDP, and we are still grappling with how to take care of our shit. That is really unacceptable. So that's why I think the mainstreaming is very important, and Samtse College of Education is one of the institution to look at it in Bella. So we look forward to working with Samtse and continue our work with education. Any other?
Thank you for the opportunity. My question is with regard to all the information that has been presented here. since from Ministry of Education and Skill Development stakeholders are also here. Now, with reference to certain incidences that had occurred pertaining to the suicide cases and the mental health issues, where the PEMA Secretariat is heading towards, and even the Ministry of Education and Skill Development, when it comes to the parents. Because ultimately, it has been evident through the reports and even the news highlight that the concerned stakeholders are taking measures through counseling interventions and even the investment and even the frameworks establishment through the framework establishment by the intervention in order to address the mental health issues of the children and as a whole. But in many instances, the parents are the last person. They're not aware of where the children and what is the status of the mental health of their children only. So in this regard, where the Ministry of Education and Skill Development and PEMA Secretariats have a provision whereby even the parents needs to be taken into board so that they are also made familiarization, and they are also, the frameworks are there to make them well aware to understand their children, because it's very difficult for a parent to teach how to do a parenting in the first place. So that's my stand on that. Thank you.
Lasla, thank you for that question. I think it's so important to engage families and communities, as you rightly pointed out. I think in terms of PEMA's approach to counseling, whether that be a post-vention intervention after self-harm has happened, or counseling when distress has happened, PEMA's approach has always been the biopsychosocial approach. So we look at the biology of it. We also look at the psychology, what the child is thinking, whether the child has an adverse childhood experiences. Then we are really looking at the social construct of that child. Where is this child placed? What is the family structure? What is the family support, kinship? All that is being assessed. So when a child in distress comes to PEMA, PEMA basically provides 3 comprehensive reports. One on the mental status of the child, second on the behavior of the child, and third, the social and the economic construct of the child. So in the severe cases, when the case goes for prosecution, these are 3 reports that goes to the Office of the Attorney General. Then the judiciary systems can also make discussions and verdicts based on the holistic landscape of that child. So our approach is, I think, as much as possible, I think the families will have to be on board. I think we have a lot of people from education here, including Dasho here. I know that from my conversation with education is also looking into parenting program. Some of the schools do have very good parenting programs, engaging the parents, going beyond your parent-teacher discussion and the marks and the performance, but going beyond that, I think there are some schools who are doing exceptionally well, but there's also an opportunity to make it better. And I think I'm told that in education, I think there are parenting programs that they are encouraging. So from the education side, I think I will not be in the position to say what the program is, but for PEMA's approach is really biopsychosocial approach to the survival. Ani last thank you. Ani last question in salam demo. Last thank you thank you Kadiche.
Thank you, Dasho. We have a token of appreciation for Dasho. So to do the honor, may I have the pleasure to invite our Honorable Chief Guest. Let's thank you, Honorable Chief Guest and Dashudechen. Now I think we'll take a short tea break since it's past 12 minutes. I think we'll come back at 11:12.